This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're heading up to the endocrinology department. We're going to be speaking with endocrinologist Dr. Chamseddin about a thyroid disease known as hypothyroidism. It's something that affects up to 1% of the U.S. population. Well, thank you for taking some time to talk about thyroid disease with us today. We're going to be talking about hypothyroidism. But before we get too far into that, I just want to get some basic information about the thyroid. Where is it located and what does it do to our bodies or in our bodies?
The thyroid is a gland that resides in the neck. It's a butterfly shape. It has a right lobe, a left lobe, and kind of bridge between the two that's called the isthmus. It's mainly responsible about the energy in the system, and hence people with hypothyroidism would have lack of energy, fatigue. It also manages slightly calcium, but the parathyroid is what manages the calcium for the most part.
Okay, so if it's acting as it should, we would never know we even have a thyroid. But
yes,
when we get into some problems with hypothyroidism, it's a disease. So what is hypothyroidism?
Hypo, it stands for the diminished function, the lesser than normal function of the thyroid gland. Anyone can get it, and it can happen at any age group, young, old, middle-aged, man, woman, anyone can get it. It shows up in multiple symptoms. It could present as being fatigued, or feeling cold all the time, or hair loss, or people gaining weight. And those are very common symptoms that people will have. Sometimes it's because of the hypothyroidism, and a simple blood test that their primary care provider can do will show us that the thyroid function is less than where we want it to be, and the treatment is simple, and it usually is a pill that people take to replace the hormone of the thyroid.
Mm-hmm. So is this strictly a genetic disease, or is this something that we might be able to prevent?
Yes, it could be genetically related, but it's not strictly genetic. And the prevention is simple. We check all our pregnant ladies' thyroid function, and we make sure that they get what they need, especially people with what we call borderline hypothyroid, because the fetus will depend on the mother's thyroxine, which is the thyroid hormone, especially the first trimester of pregnancy, because they can't make their own. After the first trimester, the fetus will start making some thyroxine, and the probability of getting profound hypothyroidism is less.
Mm-hmm. And you said it could happen at any age. So if it happens at a later age, does that mean that we have done something that we could have? Is there a way to prevent it?
No, it's not preventable. No,
yeah,
okay.
I
see your point. No, it happens. Some people are more prone to have it than others, mm-hmm. and we see that there are more advanced blood work that we can do here in the endocrinology clinic that usually primary care don't do, and those will show us who is prone to have it. If we need to, we can monitor them closely, and that put us where the younger female who are planning of getting pregnant, then we monitor them closely, so we prevent any possibility of this happening to the babies.
Okay, so if this develops within a child or an adult, mm-hmm. You mentioned some of the symptoms. Mm-hmm. At what point should we go see somebody, and is that somebody a personal health provider, or do they come see someone like you right away?
They don't have to see a specialist right away, okay. Because most of the time it's a simple blood work that their primary care provider can check, and if the thyroid function is abnormal, they can treat it. We will be happy to see them if the primary care feels that they need more advanced care.
Mm-hmm. And with the treatment you mentioned, there are some medicines available to help treat that, or is that a cure for hypothyroidism?
It's a cure for the symptoms, but if somebody has antibodies circulating in the blood that can cause hypothyroidism, and namely it's called Hashimoto's thyroiditis after the Japanese physician who described it first. The treatment is thyroid replacement, so they can get a pill and it will replace their needed hormone, and they'll be asymptomatic.
Okay. Is there anything we can do if we're diagnosed with that in terms of diet, exercise, things like that, that would help correct some of the symptoms?
Diet and exercise helps always for everything. Diet very poor in iodine could lead to hypothyroidism, because iodine is the main component of the thyroid hormone. So if we're not having enough in our diet, then the sequence of that will be hypothyroidism. And iodine is available in almost everything we eat, so that's why we rarely see people deficient in iodine in the United States.
Okay. Well, some outstanding information. We appreciate you taking some time with us today.
My pleasure.
Now, when it comes to thyroid disease, it can be diagnosed with a simple yearly checkup with blood work, so it's important to always see your primary care provider at least once a year. Now, if you have any questions about what Dr. Chamseddin was talking about, you can give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.